Vaping has surged in popularity even as overall smoking rates have declined. And among teens who use tobacco products, e-cigarettes are more popular than smoking traditional cigarettes or other ways to consume nicotine. That's raised the alarm for public health experts and triggered new laws to try and curb teen vaping. I'm Matthew Petty, and today on Florida Matters, we'll talk with two experts about the health impacts of vaping both on adults and youth. We'll discuss the role of e-cigarettes as an alternative to conventional smoking for adults who want to quit, and ask, is it being overshadowed by the rush to steer teens away from it? Also, we take a look at a new Florida law aimed to stop children from vaping. Even though vaping is far more popular now among high school students than smoking, the rates they are smoking e-cigarettes actually declined in the past few years. In 2019, an estimated 29% of high school students vaped, according to a study published in the Journal of the American Medical Association. The 2023 National Youth Tobacco Survey from the Food and Drug Administration and Centers for Disease Control and Prevention shows that 10% of high schoolers vape, and 1.6% of middle and high schoolers smoke cigarettes. In April, Governor Ron DeSantis signed a bill that restricts use of single-use, flavored e-cigarettes. It's designed to stop children from vaping and won support from the Florida Smoke-Free Association, an advocacy group for e-cigarette businesses and consumers. In a statement, the organization said the bill, quote, protects vaping options for adults, exempts open systems, regulates bad actors in our industry, and provides an avenue to protect our kids. Later in the show, we'll talk with Moffitt Cancer Center researcher Varney Simmons about how some adult smokers are turning to vaping to help them quit smoking. But first, we spoke with Yota Kitsantis, professor and chair of the Department of Population Health and Social Medicine at Florida Atlantic University's Schmidt School of Medicine. Kitsantis has a PhD in statistics and specializes in biostatistics and epidemiology. FAU published a study recently that explores the rise in vaping among youth, and we talked with Kitsantis via Zoom about the risks of vaping. We're joined by Yota Kitsantis, senior author and professor and chair of the Department of Population Health and Social Medicine at FAU Schmidt College of Medicine. Yota, thank you so much for joining us.
Thank you very much. My pleasure.
So FAU's analysis of vaping trends amongst US adolescents highlights a couple reasons why vaping is attractive. One is their image as a safer alternative to smoking, and the other is the range of flavors. Can you explain why these things are important when you consider the risks of vaping to teenagers?
Absolutely. So its recent rise in popularity certainly has been associated with packaging and advertising. Advertising of vaping products has been heavily aimed at adolescents, and it's everywhere from social media to billboards. And similar to cigarette smoking advertising, the youthful images, colors, and animation used in vaping advertising tend to be very attractive to adolescents. The packaging of these products also looks sleek, and the different pods are flavored to be specifically attractive to adolescents. And in addition, vaping products are easy to use, so that makes it even more attractive to youth. The other issue is also that vaping is perceived by some as a safer alternative to cigarette smoking. And studies show that over 60% of adolescents do not even know that Juul, for instance, the Juul pods contain nicotine. So these are, some issues or some items that can make vaping particularly attractive to teens or adolescents.
When you compare vaping to smoking cigarettes, I mean, if you are making that direct comparison, is vaping actually safer than smoking cigarettes, or are they both comparable when it comes to the risks of each?
They're actually they can have very harmful effects in this population. Nicotine and other harmful chemicals in vaping products can adversely affect the developing brain of an adolescent, and nicotine exposure and exposure to other dangerous chemicals in vaping products has been associated with cognitive deficits and impairment in memory, and along with mood disorders in this population. And teens overall are more susceptible to nicotine addiction, and therefore e-cigarettes and other vaping products, they can help create essentially a new generation addicted to nicotine. Also, many vaping devices can be used to inhale cannabinoids, and this can lead to potential cannabis use, which can have extremely harmful effects on adolescent health. And flavors and additives in vaping products have been linked to all sorts of impairments in lung functioning, which then can lead to severe chronic lung disease, heart disease, cancer, if not avoidable premature death. And therefore, vaping products are equally dangerous as combustible cigarettes, I would say.
But for that teen population, I mean, are some of them vaping rather than smoking, for example? Because that is one thing you will hear from folks who are supportive of vaping is like, it means that people are not smoking, they're vaping instead of that.
So, as I mentioned earlier, nicotine and other harmful chemicals, there are high levels in vaping products as combustible cigarettes, and therefore they are equally harmful to health. So there is no really safer alternative here when it comes to cigarette smoking.
I wanted to ask about some new legislation that was signed by Governor DeSantis last session. This is aimed at curbing vaping products that are marketed to children. The new law targets single use vapes and products with flavoring or marketing designed to appeal to children, but it doesn't apply to refillable vape products. So, what impact could this have on vaping use among adolescents?
So, given that state level policies on purchase age restrictions and smoking bans have contributed to the reduction of vaping among adolescents, one would expect that Florida's new law targeting single use vapes and vape products marketed towards children to have a positive impact in the long run. Overall, I believe that wider implementation of such policies may help intervene in preventing or reducing youth vaping. The effects, however, of these policies need to be tested in analytic studies.
We've been speaking with Iota Katsantis, senior author and professor and chair of the Department of Population Health and Social Medicine at FAU Schmidt College of Medicine. Thank you so much.
Thank you very much.
More research is needed into the health risks posed by vaping, but according to the US Food and Drug Administration, e-cigarette vapor contains fewer harmful chemicals than cigarette smoke. To learn more about how vaping is an alternative to cigarettes for many adult smokers and its role for smokers who want to quit, Florida Matters visited the Moffitt Cancer Center in Tampa. There we spoke with Vani Simmons, a PhD in clinical psychology and a senior member in the Department of Health Outcomes and Behavior at Moffitt. Well, Dr. Vani Simmons, thank you so much for speaking with us. Appreciate it.
Yes, happy to be here.
So let me ask about a very basic question about vaping. How common is it amongst adults?
So among adults, we are seeing that vaping is most common among individuals who are current smokers, who are using vaping as a way to quit smoking.
Mm-hmm. So I want to ask a little bit about that, but before we do, what impact does vaping have on smoking? Are smokers switching to vaping?
Yes, vaping has been really changed the landscape in terms of opportunities for smokers to use vaping to be able to help them to quit. So what we're finding is that individuals who smoke are attracted to using vaping or using e-cigarettes for quitting smoking because not only does it provide the nicotine, but also mimics a lot of the behavioral aspects of smoking. And so compared to traditional nicotine replacement therapies, which are FDA approved, we see a lot more appeal for e-cigarettes. And that has contributed to the popularity of adult smokers using e-cigarettes as a way to switch. Now, there are some people who get stuck in dual use. And so some of the work actually we've done here in our research group has been focused on dual users. So individuals who use both combustible traditional cigarettes as well as e-cigarettes, and trying to develop interventions to help them make the transition from dual users to exclusive e-cigarette users, and then eventually to quit their e-cigarettes as well. So the popularity of e-cigarettes among smokers is really due to it being an appealing product while providing the nicotine.
So this is kind of a debate, I suppose, and something you'll hear particularly from folks in the vaping industry. But I want to ask you, is vaping safer than smoking?
Yes, I can say that pretty confidently, that if you think about a continuum of risk and where vaping falls, according to the National Academies of Science report, we see that vaping is significantly less harmful than smoking. It does not mean that there are no harms from vaping. It does not mean that vaping is safe, but it does mean, in terms of the relative risk to combustible cigarettes, it is much safer and therefore represents a harm reduction product.
And why is that? Like, what is it that makes vaping that much safer than smoking?
Right. So when you're smoking, you are combusting tobacco and inhaling. So with that comes over 7,000 chemicals, many of which we know to be cancer causing. With vaping, you're getting much less exposure in terms of the number of chemicals. You are not getting tobacco, for example. You are not combusting the tobacco. It is a non-combustible form of getting nicotine. So you're getting the addictive component, which is the nicotine, but nicotine by itself has not been shown to be carcinogenic. So it does not lead to cancer. It's the other chemicals when you smoke that are cancer causing. And so the reason for the reduced harm reduction is because there is no combustible tobacco and you're inhaling the nicotine aerosol, which has much fewer chemicals.
So can you walk us through what's in e-cigarette vapor? Like, what are the chemical compounds in a vape cloud?
Yeah, it depends on the e-cigarette. There is a lot of variability, but essentially you are talking about aerosol nicotine, which also e-cigarettes typically include propylene glycol. They may have some flavoring chemicals, and at very high heat rates, you can see formaldehyde being produced. So those are some of the types of toxins that an individual who vapes can be exposed to.
And what are some of the risks associated with those? Like propylene glycol, for example, what does that do to your lungs?
Yeah, so in terms of the health risks, we do know that certainly there are respiratory issues that can result from using these products. Now, one of the challenges in doing research and understanding the impact of vaping is that because most people that vape have a history of either current or former smoking, it's very hard to tease apart some of the health issues that they're dealing with and to be able to disentangle that from their previous exposure to smoking. Mm-hmm. So that's one of the challenges that we deal with in terms of the research in this area.
What about young vapers then? Because it is popular amongst like adolescents, teenagers, and presumably they haven't been long-term smokers. We'd hope not. So
that's right.
That would be a population you could study and sort of look at that data kind of in a sense like separate from the whatever has been going on in their lungs with tobacco smoke.
No, you're absolutely right. So individuals who are non-smokers, that are youth, that are exclusively vaping, for example, some of the research to date suggests things such as some respiratory problems. So things like maybe increased asthma symptoms, bronchitis, and so forth. These are short-term effects. The risks that are long-term are not yet known. So we don't know what the long-term risks among exclusive vapers may be. Mm-hmm. Again, if you talk about relative risks, we know it's going to be lower than combustible cigarettes. So teens, for example, who are vaping as compared to using traditional cigarettes are getting exposed to less risk. Mm-hmm. But again, not safe. And there has been concerns that teens who vape, vaping may serve as a gateway to combustible cigarettes, but that really hasn't borne out in the data. So, for example, if it was true that vaping would lead to more cigarette smoking, you would have seen an increase in cigarette smoking over time, but instead we see an inverse relationship where vaping rates have increased and cigarette smoking rates have declined at an unprecedented speed. So, for example, high school students today, if you look at the smoking rates, it's less than 2%. So a very small number of students today are smoking compared to, years ago when the rates might have been much higher, as high as 20%. So that really doesn't support the idea that e-cigarettes lead to smoking.
Right, but at the same time, when you talk about what's in a vape, it's like the main component is nicotine, right? Which is
That's right.
very addictive. So
Yes.
You're kind of creating a population of people who are hooked on nicotine, and they're going to have to get it some way. If it's not vaping, it's going to be some other delivery method.
Right. So you're absolutely right. Nicotine is highly addictive. Now, if we think back again in terms of what are the health effects of continuing to use nicotine, we know products that are used like over-the-counter nicotine replacement products that are used over a long period of time, you really aren't seeing negative health effects of that. So this is a little bit of a controversial topic, but it's possible you can think of exposure to nicotine the way you think of exposure to caffeine. So many people are addicted, right, to their coffee in the morning. And what if we learn that the long-term risks are not significant, then do we think about nicotine the same way we think about addictions to other things that we use? So there's a lot of research to be done, and so it's a little bit of provocative to think about it in that way. And obviously, we don't want teens or anybody to feel addicted to a product because there are social implications of that. There are potential health risks. Again, it's not completely safe. There's economic negative consequences of being addicted to a product as well.
Sure thing. I want to ask about something I've heard about called popcorn lung. What can you tell me about that?
Yeah, so popcorn lung and EVALI, which was something that created a lot of media frenzy, really, I'll say. It turned out that was not the result of vaping nicotine, but rather the result of THC exposure in those vapes, along with a harmful chemical. And what happened was when the public first learned about it, it was associated with e-cigarettes and nicotine, but that was incorrect. So what public perception is now about these flavors and EVALI?
Just for my benefit, what is EVALI?
EVALI is e-cigarette and vaping associated lung injury. So that was some of the big concerns and did result in some fatalities, but again, that was related to exposure to THC and combined with this particular chemical. Once that was discovered, it was no longer, and then you just saw those rates go away in terms of what was being experienced.
This is, again, something I've read on the Moffitt Cancer Center website. Nearly 90% of people who attempt to quit smoking fail. Why is that?
That is because of the nicotine. Nicotine is very addictive and very difficult to stop using. So the idea behind using nicotine replacement therapy, for example, the reason that is effective in helping people to quit is because you're allowing people to get the nicotine from the product without at a different rate than you typically would when smoking. So imagine when you're smoking a cigarette, the nicotine hits the brain, within seconds. With using these nicotine replacement products, you get it in different modalities and typically in a much more steadier and slower dose, which is why you don't become addicted. It's very infrequent that somebody would be addicted to a nicotine replacement product. When you're smoking, you get that the rush of the nicotine, and that along with all of the behavioral aspects that go along with it, all the cues that are related to smoking and all those challenges and the way that people use smoking to manage their negative moods, for example, or the stress in their lives, all of that makes it very difficult to quit smoking.
So I understand the Moffitt Cancer Center has done some kind of large-scale research on whether vaping can help smokers quit, and you alluded to that earlier, but can you tell me a little more about that study? Like, who were you talking to? What was involved in that?
Yeah. So that was a nationwide study done with dual users, so individuals who were using both nicotine that they got from their e-cigarettes, as well as combustible cigarettes. And the goal of that study was to provide a self-help intervention to help dual users to quit smoking by using their e-cigarettes. So one of the issues is that e-cigarettes are available, but unlike FDA-approved NRT products, people don't know how to use their e-cigarettes to help them quit smoking.
And what is an NRT product?
A nicotine replacement therapy product would be a patch, nicotine gum, those things that are available over the counter. Those come with very specific instructions about dosing, how long to use them, and so forth. And many of the smoking cessation treatments that we've been developing often include pharmacotherapy to help people quit and instructions on how to use those to quit. Well, when it comes to e-cigarettes, something that our research group and my colleague, Dr. Tom Brandon, we talked about the fact that, well, when people pick up an e-cigarette, most of them are motivated to want to quit smoking, so they're very primed to want to quit. But they don't really know how to use that e-cigarette to help them quit. And so through this self-help intervention, which was a series of booklets, we were able to teach people how to use their e-cigarettes to quit. And what we did was really mirror the suggestions in a way that you would for any other nicotine replacement therapy. So think of the e-cigarette as an opportunity to get your nicotine, use it in places that you would normally smoke, but instead, use it as a substitution. So those types of strategies were given, along with teaching them cognitive and behavioral coping strategies for dealing with urges to smoke.
You're listening to Florida Matters. We're talking about vaping with Vani Simmons at the Moffitt Cancer Center. Still to come, how the focus on preventing youth from using e-cigarettes can impact messaging around smoking cessation for adults. Welcome back to Florida Matters. Let's get back to our conversation with Vani Simmons at the Moffitt Cancer Center in Tampa. Simmons and other researchers at Moffitt are studying vaping use among adults, including whether it can help cigarette smokers quit. What about the science that goes on here? I mean, aside from the nationwide study that you were talking about, like how are you incorporating sort of vaping into your study of smoking cessation and kind of cancer research?
Yeah. So what we're recognizing here is that although most of our research to date has focused on cigarette smoking, is that we can't do any study here in our group now without also measuring e-cigarette use and looking at that as a potential variable that may affect smoking cessation treatment outcomes. So it's something that we're definitely aware of. Some of the researchers in our group are also interested in looking at developing vaping cessation programs for those who are interested in quitting. Both current dual users who made that transition to exclusive vaping then may also have an interest in quitting vaping. And so we need to make sure we have evidence-based treatments for people who want to quit vaping. And similarly for youth, a lot of focus to date has been on youth prevention. And to be honest, some of the youth prevention has been a little bit problematic in that it's providing the anti-vaping messages that are received by adult smokers is influencing their use of e-cigarettes. So we really have to take a balanced approach when we're thinking about youth prevention and balancing that with e-cigarettes being a potential harm reduction tool. So for example, the public perception of e-cigarettes now is that they are just as harmful or more harmful than combustible cigarettes, which is just not accurate. And a lot of this, I think, happens to be the result of media campaigns trying to prevent youths from vaping. But then you run into the problem that smokers are no longer going to consider e-cigarette as a potential tool that is less harmful to get off of their cigarettes. So in terms of media messaging and public health campaigns, there really needs to be a much more balanced approach. And it's a very complex issue because even if you look at flavoring, for example, nobody wants youth to be using e-cigarettes, and we know they're attracted to the sweet flavors, but so are smoking adults who the flavor is attractive to them, and it's a reason that e-cigarettes are appealing. So how do you deal with something like flavors, So these are very complex issues, but I think you really can't consider one group without considering the other and thinking about messages that balance that convey that e-cigarettes are not safe in terms of absolute risk, but they are safer than smoking combustible cigarettes.
Right, so there's some nuance there that is getting a little bit lost in some of these ad campaigns.
It is, and it can have quite a significant public health implication because, with nearly 500,000 Americans dying each year from smoking, if some of those could have been moved to e-cigarettes and harm is reduced, but now they're no longer considering e-cigarettes as a harm reduction tool, you've got some pretty significant public health implications that could be happening in terms of all the anti-vaping messages that are out there for preventing youth.
What do you think of the legislation that passed after the most recent legislative session in Florida, which cracks down on certain kinds of e-cigarettes, like flavored, single-use e-cigarettes? Do you think that could have some impact on, for one thing, youth vaping, and for another thing, whether adult smokers may consider vaping or not?
Yeah, I think in terms of thinking about policy and regulations, it's important, again, to consider that balance because, for example, let's look at flavoring. We do not want youth having access to these very appealing, candy-flavored vapes. So one potential solution for that would be to make the flavored vapes only available at adult vape shops, for example, restricting access. So I think focusing on restricting access to youths is good. I don't think having significant taxes on e-cigarette that are comparable to or greater than combustible cigarettes is a good approach because, again, that's going to serve as a barrier to adult smokers making the switch to e-cigarettes. So each of these, potential policy regulations can have different impacts on these different groups. And so, again, keeping both groups in mind and what might be a better way to shift policy is key.
Is there anything else that you want to mention that I didn't ask you?
There is one other thing I'd like to mention, and that is there has not been what I think to be significant attention around the reduction in smoking rates among youth. So a lot of the discourse lately has been focused on, youth vaping, but it's not also, at the same time, we're not looking at the fact that among high school students, cigarette smoking almost doesn't exist. And that is a public health victory that nobody is really talking about. So yes, we don't want youth vaping, but let's also applaud the fact that you don't see, high school students smoking cigarettes anymore, which we know are much more risky in terms of the health impacts. We know the definitive risk of using combustible cigarettes. So I think we also need to pay some attention to where we've had some public health victories.
Mm-hmm. Well, Dr. Varney Simmons, thank you so much for joining us. Appreciate it.
Thank you. Happy to be here.
That's our show for this week. Our executive producer is Grayson Doctor. Subscribe to Florida Matters wherever you get your podcasts. I'm Matthew Petty. Thanks for listening.